Dr. Patrick Beeman is a distinguished physician based in Ohio and renowned for his expertise in women's health and medical ethics. With a robust background as an OBGYN, Dr. Beeman has dedicated much of his career to advancing the understanding and the treatment of women's health. As a passionate advocate for patient education and empowerment, he combines clinical expertise with a compassionate approach to care. In addition to his medical practice, Dr. Beman is an engaging speaker and thought leader, frequently sharing insights on the latest developments in women's health. So join us on Abruptly Authentic as we explore the complexities of ovarian cancer with Dr. Beman, gaining valuable perspectives on prevention, treatment, and the future of women's health.
Highways of love. What's it gonna be? Are you gonna stay? Are you gonna go? Highways of love.
Welcome to Abruptly Authentic. I'm Hollie Strano, and I told you on the last episode that I was going to bring our team doctor, Dr. Beman, back on the show, and we introduced you to him briefly weeks ago, and a lot of you have been questioning, where is he gone? When are we going to see him? And I wanted to wait until I shared my sort of moment-by-moment cancer journey with you to bring Dr. Beman back into the picture. He is an OBGYN. He also specializes in addiction with pregnant women. Mm-hmm. So thank you for being here.
Thanks for having me.
I think that this is an important conversation.
Yeah.
And I did not have doctor vocabulary in my last episode. So I'd like to talk to you and have you better explain some of the things that I probably didn't in the last episode.
Yeah, I'd be happy to. Actually, I mean, this is something I really like to do. And I think a lot of patients, I mean, half the time I leave the doctor, I'm like, what was I supposed to do? You know, even myself being one. So, yeah, let's get into it and stop me if I get too technical.
No.
And I will try to be conscientious about that.
I shared my medical records with you.
Yes.
In regards to my ovarian cancer journey, my tests, and I had 2 surgeries. So you have seen that.
Yes.
So what questions do you have for me?
What got you to go to your doctor? Mm-hmm. What was your chief complaint or concern?
This was before the accident. And I had had irregular bleeding, which for me was like a lot of bleeding. And so I went and I never went back and followed up with it.
So average age of menopause is 51 in the United States, right? So, you know, this was initially you go to your doctor, what, early 2024-ish?
It was before the accident. So the first time I went was in 2023.
Okay. And prior to that, you had like regular cycles?
As far as regular periods?
Yeah.
Correct.
Okay. And when did that change?
What changed about this particular instance of bleeding was that it was a lot.
Okay. So heavy.
Yeah.
Right.
To a point where I was like, that's weird.
The bleeding that you had that made you think, oh, that's a little weird.
Yeah.
Was that just a longer cycle or just the amount?
The amount. Then I just kind of put it on. The accident happened and I was in then a place of shock, high cortisol, all those things. I wasn't even thinking of anything other than just somebody please help. Right?
Yeah.
And that was therapy. And then once I was through therapy and had transitioned to life coach and team, and so then it was time to start conquering things. You know, I'm clear-headed and questions would come up, you know, because now we're not in therapy anymore. We're just a team working together. And the medical stuff came up. And so like I hadn't gotten blood work for 3 years, you know, so that was the first thing I did. And then I explained to them that I had this, you know, bleeding and it was met with resistance, like go to the doctor. And I did. And they did an ultrasound, and it was okay. So more than likely, this is like where, the egg probably came out then. But there's this thing.
Yeah.
And it wasn't a concerned, there's a thing.
Yeah.
It was just like, could be a fibroid. And then I went back to my team and reported these things. They really pushed me to push for an MRI, which I did.
Okay.
And then that came back with the thing being suspiciously malignant.
Gotcha.
And that just about put me over the edge.
Okay, so you have this ultrasound result. There's a little cyst or whatever they call it on the
Fibroid, maybe. You know what I mean?
In the adnexa or the area to the sides, the uterus, ovaries, tubes mostly.
Correct.
And then they probably said what, like, we redo this in 3
6
to
months.
6 months or
Yep.
something like that.
Yep.
And you're like,
No.
that doesn't sit well with me.
Right.
Got it. So actually, I mean, here's where anxiety can be protective.
So the MRI happens, and then the suspiciously malignant happens. And then I told my team about that, and it was, okay, you're going to advocate for yourself here. So you're going to advocate for yourself as a woman, and you're going to ask that they remove both your ovaries and fallopian tubes. And that was met with some resistance. He said I would just take out the one, and I said I want both, and it was like, okay. And, so went into that surgery, had it done. And so then, I won't get into the whole story, but fast as much as I did in the last episode, because a lot of you might have seen that, but I get a phone call that it's cancer.
Yeah.
About a week later from him. And
On a Friday?
I don't know. I don't know if it was a Friday.
I only ask because it does seem there is a law of the universe that bad news always comes up for us physicians around 4-ish p.m. on a Friday, where you have to decide,
It was.
do I want to tell this patient this over the weekend or wait till Monday? Yeah.
I have anxiety right now
Thinking
just
about that.
hearing you say that, and the fact that what you must go through, or if that maybe doesn't make you anxious, but like to be the bearer of that news.
Yeah, I mean, breaking bad news is definitely the, not the best part of our job, I suppose.
Getting
especially
sweaty.
Especially
thinking about
OBGYN,
it.
since, usually we're involved in the happy moments.
Yeah,
of
and the
people's
reality
lives.
is you're assuring, and you're, by knowing what you're able to fix us.
Yeah.
And you know what? It was around 4:00. I do remember that.
Yeah.
For sure. It was later in the day because I was coming home from meetings and things. And
Was it your actual doctor who called? Okay, good.
yeah.
So that's
So
a
I
mark.
saw-
That's a mark of a good physician.
Yes.
Who doesn't farm that out
No.
to someone else.
No, it was a genuine, beautiful phone conversation between us.
Yeah.
And then I called my team after. And the first thing I asked him was am I going to die? And he said, oh, gosh, no. He's like, you caught this in a place where nobody catches it.
Yeah. Yeah, that's what's really interesting to me. It's, somebody must have been looking out for you.
Well, and let's not forget again, let me be the elephant in our little doctor appointment here. I drank heavily for a long time, and alcohol is a cause of cancer.
Yeah. Yeah, it is.
Yeah. And you're an addictive doctor.
Addiction doctor.
Addiction doctor.
I do kind of have my
But you
own
know what I'm saying?
addictive personality.
You specialize in that too.
Yes, yeah.
I will just say that I believe that could have been part of it.
Yeah.
Part of why I got it.
Yes. Yeah. I mean, definitely alcohol is carcinogenic.
Do I know that
and
for a fact? No, but
we know alcohol is carcinogenic.
yeah, it's poison.
And then after that surgery, you get the call. You end up having another surgery to kind of definitively treat this, right?
Because it was cancer.
Right.
So they had to remove my uterus.
Correct. Yeah. So, and then they also did like a bunch of other things to examine the lining of the inside of your abdomen, different surfaces of other organs. You were staged. That is kind of the summary. Like after that initial surgery that revealed the pathology of that spot, that cyst, whatever, was noticed initially was cancer. Now it's what stage is this, right? And you can't really do that without a very systematic approach, the way that GYN oncology specialists approach it. And part of that does involve removing the uterus in this case. So all that makes sense. I'm curious, the time from that phone call until the next point of contact with the GYN oncologist, how long was that?
Oh, days.
Oh, really?
Yeah.
Oh, nice, because sometimes it's not.
No.
In a lot of areas of the country, I mean, it's a month out,
No, that would not have been okay for me.
That, as far as anxiety goes, I mean, I hate just that practical
Waiting.
situation, because what are you going to do for
And you
a
feel
month?
like a ticking time bomb.
And all you hear is, like you said, or think is,
I know.
I'm going to die. So you had the second surgery within weeks-ish?
Yeah.
That's pretty good.
They don't like to do it, but they did it.
Yeah, well, I mean, we don't like to do a lot of things, but sometimes it's necessary. Now, as an OBGYN, if I'm talking to a woman who's perimenopausal, kind of in that age range, has one cycle that's out of whack, then, I'm not going to jump to that diagnosis, the one that you particularly had, right? There is a step-by-step workup that was appropriate for you. You got the ultrasound, it's a close follow-up, some blood work here. But I think the thing to take away just from ovarian cancer generally is that most of them don't have any symptoms until they are way late. But what I would say is the thing that women should keep in mind is, the majority of ovarian cancers are not the type you had, okay?
Okay.
They are diagnosed later. But when people do have symptoms early on, they're very subtle. Three kind of things that a woman should really pay attention to, especially as, you get over age, 50-ish, is early fullness. I used to eat, a whole hamburger. Now I can only eat half, and I'm the same level of fullness. So early satiety or early fullness is that should kind of raise your alarm bells, or you should pay attention to it. The other thing is bloating, like non-specific, but you're just generally having bloating, like, I have to loosen the belt loop or go up a pant size. And then pelvic pain or pressure or just, odd sensations down there.
Everything you just said,
Yeah.
they're so generalized.
They are. It's more concerning, though, when they occur all together. And, I mean, look, if somebody comes to me and says any of these words, I'm going to talk to them and like, what's your family history? Oh, you had a mom and a sister who had ovarian cancer or breast cancer, then obviously huge, more concern, more alarm bells for us. It often is missed because people are not vigilant about health maintenance, prevention, and knowing themselves, right?
Yeah.
So it's not typical to just show up for your yearly, have no problems, boom, we see things or are suspicious of something, and we catch a diagnosis. The way people catch diagnoses early is when they themselves advocate for what they want. They don't just write off their anxiety or let people in the healthcare system write off their concerns as simply anxiety.
And that happens, sadly.
It kind of happens all the time, yeah.
I want to change that so bad.
When it comes to advocating for yourself, I mean, I'll be honest, sometimes you can be more effective as a patient in helping your doctor get to an answer for you by being measured or knowing how to talk, right? Or how to approach things. And I want to be careful here because I don't want to discourage people. If you send 10 portal messages per day to your healthcare team, that probably will decrease their vigilance and concern, whatever your concern is, just generally in patient care. I'm just being honest. It sucks. Like somebody with that much anxiety or worry or issues, like they probably need more attention. Like maybe not from that particular doctor or healthcare team or whatever.
I understand what you're saying.
You know what I'm saying?
I do.
And so I often tell patients, and I apply this to myself, look, the best thing you can do is find a doctor you can have a relationship based on trust with, like you don't vibe with,
correct,
someone, go somewhere else, right? You have and at the same time, you have a bad experience in one healthcare system. That doesn't mean you should write off
the healthcare system.
Like there are good docs in every institution and other clinicians.
It's like I said,
but you got to find one that works for you.
And you're human. So there might be an experience that isn't perfect, and that's okay.
Yeah.
Dr. Beeman, to me, 1 in 80 people. And I know compared to breast cancer, that's not as much, but it's still a lot. And the bottom line is I want to help. What can we do?
I would say first prevention. So it's all the health behaviors.
And this applies to all medical things.
Yeah.
I'm not going to just single out ovarian cancer.
I mean,
I'm talking about just well-being and health. What can we do?
I mean, if you zoom out, you probably solve 90% of health things through diet, exercise, sleep, good relationships, healthy relationships, and having a plan of life, a spirituality, a path, a goal, whatever that is. And so I would say all of us probably could do some of those things better. Myself included,
always.
You, everyone here.
All of you.
But it takes work. You said it, right?
Yeah, it does.
I mean, all the stuff that really moves the needle in terms of improving health outcomes or even better, preventing them from happening.
Correct.
They do take work. Staying ahead of things, working on those health behaviors is probably the most paramount thing. At the same time, it's not the whole of it, right? So it is true. Like you should do health maintenance, visits with a professional who is used to hearing stories and has the ability to order various tests that pick up things that are silent long before, they end up becoming a disease that's diagnosable. You should probably check in with your doctor or healthcare team once a year. Totally reasonable.
Yeah.
And you should probably take their advice. If you don't want to take their advice because you don't trust them, you should probably switch to someone else. And you should be able to just have kind of like a normal, healthy relationship with your treatment professional.
Agreed.
And be able to see things get better because you have a relationship with them.
One of the things that I've learned on this journey is that you're doing yourself not one bit of good by going to a doctor and putting it on, so to speak. I'm very, very honest with my doctors now.
Yeah.
This journey has taught me that.
And you should be.
So I think being honest is going to really get you much further in a really healthy medical journey.
Yeah. And two, I would say embarrassment is a big factor in people not getting treatment or worked up
Agreed.
or addressing their problems. Yeah.
But I'm on a mission, and I know you are too, to make a difference.
Yeah,
So we're going to
absolutely.
talk.
Let's do it.
And we're going to be embarrassed, and that's okay.
Highways of love. What's it gonna be? Are you gonna
No, absolutely.
Yeah. Oh,
Hope it's a patient. How's my hair?
it looks great. It's got a nice, like, little feathery wave at the top.
Yeah.
I mean, I think you could be having a better hair day than me.
chasing shadows on the